my lovely. I'll be with you in a second, okay? Let me just check what we're doing for you today. Okay. So you've come in as an emergency. Alright. You've been having some ear pain? Okay. And you think you've got a Q-tip wedged down your ear. Okay. How long has it been down there? A week? Gosh. You should have come to us before then, really. Okay. Alright. Have you tried to get the Q-tip out? Okay. Yeah. Alright. So it's just in the one ear. But you have problems with both of your ears, with them being blocked. Right. Okay. Yeah, we need to get this out before we have a nasty infection, if we haven't got one already. Okay. Alright. Going to pop some gloves on. Firstly, I'll need to take a look, alright? To see what I'm able to do and how I'm going to do it. Okay, so it's your left ear that's got the Q-tip in. Right, okay. I'm just going to get a few things together. Okay, right. I'm going to wipe your ears first, okay? Just do this right here first. Wipe around the outside, very gently. Okay. We'll do this one. Anymore. Okay. I'll take a look down the slightly better ear first, okay, the one without the Q-tip in. I'm just going to use this otoscope, okay, and that will shine a light, make sure it's working okay, yeah, down your ear, alright. I need you to keep very still for me. I'm sorry if it's a little bit uncomfortable, but I'll probably be numbing your ears up shortly, alright, but I need to take a look first to see what I'm dealing with. Okay, my lovely, just relax there, okay. Righty. So, I'm just going to gently pull up and back on your ear, my lovely, and insert this, okay. Be very gentle. Here we go. This has got a lot of wax in it. I can't see down here properly. It's really blocked. Lovely. There's a lot of impacted wax in there. Yeah. So I can't see down, I can't see your eardrum. I can see it's irritated, but that's normal with such a hard impaction. Alright? So I'm now going to look at this one that's causing you a lot of pain. I'll be very gentle, but I can't promise this won't hurt a little bit until we get it numbed up. Okay. Just keep still again for me. Alright, here we go, just gently pulling up and back. And in we go. Oh, gosh. I can see a Q-tip and wax and some discharge from the irritation there. Alright, let me withdraw that. Okay. So, it looks like I'm going to have to use a couple of different methods here. I'm going to numb your ears. I'm going to put some special drops down afterwards, okay? The numbing will be drops as well, but then I need to put some drops down that are going to fizz a little bit and break down some of that wax, okay? I can try and remove the Q-tip at that point, but it might be worth me just doing a little bit of microsuction just around inside the ear, just to remove some of that wax from a little bit deeper down if I can. Okay, and around it. And then afterwards, if I can get the Q-tip out, I can clean a bit further down as well, or use the microsuction again. But I won't know until I start, okay? Alright, my lovely, so let me just get some protective covers around you so anything that comes out of your ears won't go on top of you. Alright, okay. Right, and pop that on there. Perfect. Okay, that's one side done. There, so that'll keep you nice and protected while I work on these ears of yours. Okay, lovely. Right. So, as promised, I'm going to numb up your ears. Alright. Just going to use some drops. They won't sting or burn, they'll just feel a little bit cool. Alright. Okay. Here we go. Right, here's one. Here's two. There we go. Make sure you cover it. Perfect. Okay, right. One with this side. Here's one, and then two. Okay, there we go. Right. So your ears will go numb now. I'm just turning off my otoscope. I left the light on there, which wasn't very clever of me. Don't want that going dead on us. So they'll numb up nicely now. Alright, and then I can put some other drops down to try and break that very, very hard impacted wax around that's probably holding that Q-tip in there. Yeah, I don't want to start pulling and pulling if I can make the whole thing a little bit less traumatic by softening the wax. Alright? Yeah, have you had problems with earwax before? Right, okay, because it's a good idea to get them cleaned every few months, maybe, if you get a lot of build-up, to prevent this happening, because it can cause problems with your hearing, yeah, and cause the ear canal to become quite inflamed. Alright? Okay. So let's get some nice drops down there. These will make a little fizzing sound, alright? They won't sting or burn, but your ears should be numb now anyway. Okay. Tell me if anything's uncomfortable though, won't you? Okay. Right, let's put a few of these down. So There's one. Two. And three. There we go. Enjoy the fizzing. Okay, there's one, two, and three. Okay. Right there. Good. Okay, I just need to check a few things here, make sure I've got everything that I need. I'm pretty sure I have. Okay. Right. What I'm going to do is I'm going to have another little look down, okay, to see if it looks like the wax has melted away a little, and then I'll make a decision on how I'm going to go forward with it. Okay? Alright. Just a little look down here, okay? Keep still, my lovely, while I just pop this in, okay? There we go. Wonderful. Okay. Yeah, looks like some of that's melted away. Okay. Let me just try and remove a little bit of that loose wax while I'm here. Keep nice and still for me. Okay. Lovely. Just going to very gently just clear a little bit away, as I can see. Okay. So I can get to that Q-tip more easily. Alright. Perfect. You're all right there. Good. I'll have a little clean of this side. So I'm going to use the Microsuction tool shortly, alright? Now could you feel anything there? No. Perfect, okay. So the Microsuction tool just has a nozzle that goes inside your ear, okay? And you'll hear some little suctioning and little crackling sounds. But what it does, obviously, it suctions away any loose wax that it can get to, and it's a lot more comfortable than scraping away. Okay, my lovely? So you just relax a second and I'll get that set up. Okay. Okay then, my lovely. You alright there? Good. So, here's the Microsuction tool, alright? So I'm going to gently pop it inside your ear and just try and suck away that wax, okay? Alright, keep nice and still and pop up your hand if it doesn't feel comfortable at any point, okay? Alright, so let's get to work on your worst ear first here. Okay, you ready? 1, 2, 3, here we go, okay. Well done. Well, coming away really well. You alright there, my lovely? Good. So there's a lot of wax just come out of there, okay? I just need to have another little look down, okay? And then I will try and pull out that little Q-tip end. Alright, okay. I'm sorry this is a lot of digging around in your ear. Okay. Right, I've got a nice clear view of that now. Right, if you just hold still for me, my lovely, I'm just going to have a little pick and see if I can get this out, okay? Alright, I've got a grip on it now. Right, hopefully you're numb. I'm just going to have a pull on that now, okay? Very gently, okay? Are you ready? Okay. 1, 2, 3. Okay, there we go. Well done. Okay. And there it is. That's what's been stuck down your ear, covered in old earwax there. Okay? Don't ever do that again, because that can be really dangerous. Alright. You shouldn't put Q-tips down your ears, only on the outer part. Okay? But there, we've got that out, so that's good. Okay. So I'm going to have a look and see if I can get a little bit more out with the microsuction on your right ear, okay? Just to get the remainder of that wax out. Right, okay, just bear with me. Just got to grab the tools. Okay. Alright, so I'm just going to pop this in your ear also. Just need to make sure I've got that set there. Perfect. Alright. Okay. Nice and still for me again, and you'll just hear those strange little sounds as I get to work with the microsuction tool here. Okay, here we go. 1, 2, 3. Doing really well. Okay, perfect. That wasn't so bad, was it? No. Okay, let's just pop that there. It'll stay there. Alright, wonderful. Okay, so how are you feeling? You're not feeling dizzy or anything? Okay, good, good. Alright, so I need to take a little look down your ears one more time. And I'm going to pop some drops down there, which are antibiotic drops, because they do look a little bit inflamed, possibly a little bit infected on this left side. Okay, and then you can take the drops away with you. We'll get you a prescription at the pharmacy. Alright? Okay, so let's just take another little look down there, my lovely. Okay. I'll be gentle. Here we go. Just pull up and back gently and just insert that now, okay? Okay. That's looking a lot better. There's a little bit of wax left, but I can see your eardrum now. Okay, which is good. Okay, much better. And as you'd expect, this is inflamed because of having that Q-tip down there. But it's looking much cleaner now. Just reposition that. Much better. Okay, lovely. There we go. Okay, good. Just like to keep checking because having things done around your ears can make you feel a little bit dizzy sometimes. Alright. And a nice little look on this side. And then I'll just put some more drops down and then we're done. Okay, here we go. This looks a lot cleaner now. Microsuction is wonderful. Don't want to do too much in the way of picking. Not when they're inflamed. Okay. Yeah, I'm happy with that. Okay. Remove that now. Wonderful. Good. Okay, I'll just need to just type a couple of things here. I'll just get a prescription ready at the pharmacy for you. Okay, that's all gone over. So the drops that I'm going to put in now, you'll need to put in 3 times a day for 5 days, okay? If you're not feeling well or you feel a lot of discomfort, then please just call us back, okay? Or if you get any unusual discharge, I mean the drops may run out a little, but if you're seeing blood, pus or anything unusual coming out of your ears, alright, you just need to give us a call, okay? Right, so let's get a couple of these, so just 2 drops, alright. Okay. Right. Here's 1. And 2. There we go. Just going to give you a little wipe. Okay. And I can remove that cover now. Perfect. Okay. Let's get some in this other ear. Okay, here's 1 and 2. Perfect, little wipe. Okay, and I'll remove that cover. Right. So you're feeling okay? Wonderful. So your prescription will be ready out there if you just pop to the pharmacy. Okay. So remember, do come back if there's anything unusual or you don't feel well. But we have removed that offending little Q-tip end, alright? But please, don't do that again. Alright. Were you trying to clean the ear? Was it itching? Okay, yeah. I know they fit down, don't they? And it's easy to do, but they can leave fibres, they can just cause irritation, they can cause otitis, which is like an inflammation and infection of the ear canal, you know, and worse, they can, obviously it can damage the eardrum as well if they go too far down, so it's not a good idea, no. Okay, so you've been told off. Yeah. Alright then, my lovely, so if you're feeling okay, pop and get your prescription, alright. If you do feel a little bit dizzy, just tell the nurse outside and they can sit you down, okay. Alright, you take care then. Bye bye.